As the patient is presented for a comprehensive periodontal examination, some systemic conditions or diseases that should be taken into consideration based on the patient's medical history include periodontal disease, cardiovascular disease such as atherosclerosis, diabetes, kidney disease, hypertension, and congestive heart failure, especially with his recent coronary stent placed. Periodontal disease has a bidirectional relationship with these systemic diseases, as the bacteria and inflammation may contribute to the cause of these systemic diseases. For periodontal disease, the inflammatory processes occurs around the tissues that surround the teeth in response to bacterial accumulation and dental microbial plaque, which leads to gingival bleeding and tooth attachment loss. This is a concerning issue as the oral cavity is an open system exposed to the environment. Large numbers of bacteria accumulate from food and liquid intake. So for compromised oral cavity to periodontal disease, it can become a gateway to foreign invaders to cause these systemic diseases. There are other risk factors and mediators of these systemic conditions, such as the medications and social habits, like smoking and nutritional dietary behaviors. Because of this, it is crucial to maintain proper oral health and reduce any chance of periodontal problems by catching any clear signs and symptoms during the patient's periodontal examination.
Hello, my name is Hunter Barroso, and today I'll be presenting our patient's vitals. The patient presents with a pulse rate of 65 beats per minute, which is normal, and a blood pressure of 145/90. This blood pressure is quite high and qualifies as a stage 2 hypertension. Common practices dictate that we immediately refer him to a physician to be put on antihypertensive medications. Our patient, however, is already on such antihypertensive medications, and we are currently waiting for those medications to take effect. The patient's blood pressure is still quite high, so it is unadvisable to perform any kind of serious dental procedure such as periodontal surgery, oral surgery, or any kind of serious extraction, as it could cause unnecessary complications to our patient, and it would not be in the best interest of our patient's health. Thank you.
Greetings. My name is Itete Dan, and I'm going to be discussing the management of the patient due to his diseases. Stress management is very important with patients that have cardiac disease, diabetes, and also adrenal cortical insufficiency. This patient having congestive heart failure may experience pulmonary edema, which will result in breathing troubles. Since he is also a diabetic patient, stress may alter his glucose metabolism, which will result in a higher blood glucose levels. The way to manage stress with these patients is to see them on time, plan for post-operative pain by prescribing analgesics, and also perform shorter appointments. We want to inform the patients about the treatment plan and the procedures that we will be performing on a day-to-day basis as well. We want to empower them with a sense of control by telling them they can use hand signals to let us know that they're in pain or that they want to just stop. We also want to call them at home after the treatment just to make sure that they're doing okay. Another big thing is patient positioning. Some patients suffer from breathing difficulties when placed in the supine position. So we want to consider treating them in an upright position, and especially this patient in particular because he has congestive heart failure. Thank you.
Because this patient has multiple comorbidities, it is necessary to consult with the cardiologist, endocrinologist, and nephrologist to be cleared for dental treatment. From the endocrinologist, I would want a consultation for the diabetes. I want to know the hemoglobin A1C. I want to know how the disease is being managed, any current trend in the blood glucose levels, and the micrograms per milligram of insulin being taken. And depending on these results, there may be a need for prophylactic antibiotics prior to the treatment. From the cardiologist, I would want a consultation for the recent coronary artery stent placement, the congestive heart failure, and hypertension. With that, I want to obtain an EKG or MRI for potential prophylactic antibiotics for dental treatment. I also want to know the severity of the congestive heart failure in order to know if I will need to make special arrangements in regard to patient positioning while in the dental chair. Since the patient has stage 2 hypertension, I want to know how is it being managed, the milligrams of Plavix, digoxin, aspirin, atenolol, and nifedipine the patient is on. From the nephrologist, I would want a consultation for the kidney disease and hemodialysis. If poorly managed along with congestive heart failure, could be problematic for the patient positioning in the dental chair due to fluid overload. I also want to know what stage of kidney disease the patient is at, any medications related to the kidney disease because there may be delayed wound healing, a CBC, which is a complete blood panel with a coagulation test, but also I want to know which days the patient gets hemodialysis so that I can coordinate treatment potentially to the day right after hemodialysis to reduce infection risk. So my consultation write-up would be the date, myself as a referring physician, and the reason for consultation would be clearance for dental treatment. In that consultation, I also want to make sure that I put the history of any present illness that the patient may have, any prior surgical history, any social history, the medications that are being taken, any allergies that are known of, and then a plan and recommendation so that the patient can receive dental treatment.
Today I'm going to discuss the ASA classification, which stands for the American Society of Anesthesiology. And the purpose of the classification is to evaluate risk when performing a surgical procedure. I believe our patient is class 3. The class ranking system is from 1 to 5. Class 3 is someone that can walk up a flight of stairs or a couple flights of stairs, but will have to stop and take short breaks. I believe our patient fits into this category due to their medical history, which includes a coronary stent that was placed 2 weeks ago, diabetes, kidney disease, and hypertension, and congestive heart failure. These factors have been huge indicators on why I believe that our patient is class 3.
Due to our patient's extensive medical history, there are certain medications he must take. All of his medications have symptoms that can possibly develop into intraoral abnormalities. Atenolol is an oral tablet medication used for the treatment of hypertension and may cause swelling of the throat and tongue. Nifedipine is an oral tablet medication used for the treatment of hypertension and congestive heart failure that may cause swelling of the lips and tongue, as well as trouble swallowing due to an allergic reaction. Digoxin is an oral tablet medication used for the treatment of congestive heart failure and may cause swelling of the tongue and vomiting, which may lead to tooth enamel destruction. Insulin is an injected medication used for the treatment of diabetes and may cause tingling and numbness in the lips and tongue, as well as slurred speech. Plavix is an oral tablet medication used as an anticoagulant. This may cause purpura or purplish spots in the mucous membrane of the oral cavity due to bleeding underneath, as well as vomiting that may lead to tooth enamel destruction. 81 aspirin is an oral tablet medication used for the treatment of cardiac health. Bleeding gums as well as vomiting is also observed.
Hello, I'm going to be answering the question of might there be possible side effects or possible impacts from the medication on dental treatment. The answer to that question is yes. The medications the patient is taking may cause adverse events and thus a halt to treatment. For example, the digoxin and nifedipine treating the patient's congestive heart failure and hypertension may cause swelling of both the lips and the tongue. The Plavix, being an anticoagulant, may cause excess bleeding during the procedure. Aspirin may have a similar effect. Assuming that the patient is not experiencing any adverse events from their hypertension and congestive heart failure medications, the main cause of concern would be potential of excess bleeding caused by the Plavix and the aspirin.
Hi, I'm Sheikh Adams, and I will be discussing the impact of the patient's social and past dental history and how that's relevant to their ASA level. So the patient's social and dental history certainly does cause an impact on his ASA level, more so his social history. Males in general usually are at a higher risk for periodontal diseases due to a higher titer count of antibodies to prostaglandins, and this is usually from infection by periodontitis. So if our patient had untreated periodontal disease, then that could have progressed the infection stimulus for atherosclerosis. Chronic bacterial infections have also associated with the development of atherosclerosis, coronary obstruction, cerebrovascular disease, and peripheral artery disease. Our patient's social history has even higher impact on his ASA level because he had a negative social history. Smoking and drinking are high risk factors for CVD, and some cancers are also associated with periodontal disease, with the common link being chronic inflammation. So his social and past dental status plays a major role in his current physical conditions and method of treatment, so it should be taken into careful consideration.
Hello, my name is Melissa. The primary etiology for periodontal disease is shifting the plaque biofilm from housing good bacteria to bad bacteria. In this patient, kidney disease mediated by diabetes has led to xerostomia, and the kidney disease has led to a decrease in calcium, leading to subsequent weak bones and lack of support for the teeth. These conditions create the ideal environment for plaque buildup and periodontitis. Early culinarians are able to degrade the connective tissue attachments to these teeth using carbohydrates and saliva in the oral cavity for nutrition. Once they eat through that, they will then allow detrimental gram-negative anaerobic bacteria and spirochetes to approach. Due to the diabetes, responses to these late bacterial colonies, such as T. forsythia, T. denticula, A. actinomycans, and specifically Porphyromonas gingivalis, are prolonged, and a myriad of inflammatory cytokines are released, including interleukin-6 and TNF-alpha. Those two actually upregulate acute phase protein CRP, and the increase in that CRP is linked to periodontitis.
Contributing factors do not themselves initiate periodontal disease, but rather modify the progression of the disease itself. Local factors include occlusal trauma, food impaction, incorrect toothbrushing, and iatrogenic dentistry. Whenever patients use a very hard toothbrush and brush their teeth incorrectly, gingival recession occurs, which exposes the root of the tooth. Food impaction can also occur when the contact is slightly open between two teeth. This will eventually lead to damage in the gingival tissue. Another contributing factor is the iatrogenic factor, which occurs when there are over-bulking contours, overhanging edges, and incomplete seal. They may contribute to gum inflammation because they will trap bacterial plaque and make it very difficult to remove it by the patient. Occlusal trauma is another contributing factor since it leads to injury to attachment apparatus due to the excessive occlusal force.